So as a former medical malpractice defense lawyer, I have the utmost respect for physicians, nurses, and everyone really in the medical community. But what has transpired over the last few years is significant, and it's led to, I think, the worst medical care that's ever been provided in the U.S. You can use the pandemic as kind of a marker, but the issues really started before the pandemic, and it has to do with your medical insurance. Okay, you say to yourself, how could medical insurance cause care to be worse? Well, here's how. When a physician does, let's say, a surgery, the medical insurance will come in and say, we're going to give you $1,000 for this procedure. The doctor could bill $5,000 for that procedure, but the medical insurance is going to only reimburse him or her, that surgeon, $1,000. What do you think that surgeon's going to do when they see their income decreasing? They're going to schedule more surgeries. That's going to lead to more post-operative patients, more phone calls, more visits, more complaints from their patients that are valid complaints. So prior to the pandemic, this medical insurance reimbursement that keeps going lower and lower for these poor doctors really exhausted the entire industry because they had so much volume that they had to really kind of account for in order to make the kind of wages that they think they should be making. Then we have the pandemic. What happens during the pandemic to affect medical care long term? First of all, unfortunately, a lot of people died, and care providers became really desensitized to death and severe brain damage from COVID. But the most important aspect is there was a large hiatus of medical care providers out of the industry. They quit. They became exhausted. They didn't want to be exposed to COVID, and so they left. What was left behind were a lesser volume of physicians, a lesser volume of trained nurses and experienced nurses. And so the industry reacted by trying to hire, obviously, individuals to replace them. These people, in many cases, come out of school after only 2 years of education instead of 4, as it pertains to registered nurses. These individuals are put on ICU floors directly out of school, and so they don't have the experience necessary to take care of somebody. Physicians would then use what are called physician extenders, physician's assistants, PAs. We've seen them a lot, right? CNPs are certified nurse practitioner. That's an RN who gets additional certification. And what was going on is the physicians were short-staffed, so in the ER, instead of seeing an ER doctor, an MD, you're seeing a PA or a CNP many times. And the doctor would oversee all these individuals. Well, even though PAs and CNPs have, advanced degrees, they're not as experienced as a doctor. They're not, as qualified as a doctor. And so the medical care, unfortunately, suffers. And there's a lot of negligence that we're seeing now because of medical reimbursement problems, staff exhaustion, and physician extenders where you used to see physicians. And the amount of cases that we have taken in is astronomical in the last 3 years because of all these factors have really, I think, broken the medical system here in the United States.